making a decision to use the intrauterine contraceptive device, it is important to give the patient an opportunity to consider the use of other methods of contraception that is available. It is important to make sure that the patient is suitable to use this method. The World Health Organization has recognized contraindication for use of the intrauterine contraceptive device, and a list of contraindications are shown now. It is important to counsel the patient with regard to use of the intrauterine contraceptive device before insertion. The patient should be informed that this device acts for a period of 10 years and return of fertility after removal is fairly soon. The side effects of this intrauterine contraceptive device should be described to the patient. A list of side effects are shown now. The patient also should be informed that following the insertion of the intrauterine contraceptive device, that she should expect some abdominal cramps, mild irregular bleeding, and painful periods may be for the next 4 to 5 months. It is important to tell her that these symptoms will disappear with time. For the insertion of the intrauterine contraceptive device, you need to keep the patient either in the dorsal position or in the lithotomy position. Prior to insertion, it is important to do a digital pelvic examination to exclude any pelvic pathology, including infection. The next step is to do a speculum examination using the Casco's bivalve speculum. Once you see the cervix, you need to clean the cervix with antiseptic solution, since during this procedure all precaution should be taken to maintain the sterility. Next, I will demonstrate the rest of the procedure using the model. Before the insertion of the intrauterine device, you have to measure the direction and the length of the uterine cavity by using the uterine sound. Once the length of the uterine cavity is measured, you have to keep a mark on it. Now let me demonstrate how to load the intrauterine contraceptive device. First, you open the pack on the opposite side of the intrauterine device. Do not open it completely but partially. Then you take the inner white rod and insert it into the clear outer tube and push the inner rod up to the bottom of the intrauterine device. The next step is to put the horizontal arms into the outer tube. You need to hold the end of the horizontal arms and bend it downwards so that the two arms is pushed inside the outer tube. Now you see the horizontal arms are pushed inside the outer tube. Once you have done this, you need to move this movable part, which is in blue color, depending on the length of the uterine cavity you measured earlier. You have to use the scale shown in this paper to adjust the length. It is also important to keep the blue colored movable part horizontally on the direction of the horizontal arms. Once you have done this, the loading is complete and the intrauterine device is ready for insertion. Let me now demonstrate the insertion of the intrauterine contraceptive device. You need to take the device from the package and then stabilize the uterus by holding the cervix with a tenaculum. Then you introduce the intrauterine device through the cervical canal and advance it towards the uterine fundus up to a point that the blue movable part comes into contact with the cervix. Now you steady the inner rod and withdraw the outer clear tube up to the handle of the inner tube. While you are doing this, the horizontal arms will get released. Then you need to steady the outer tube and withdraw the inner rod completely. Once you have done this, make sure that you again move the outer tubes towards the uterine fundus so that it will help to position the intrauterine device properly in the uterine cavity. Then you withdraw the outer tube completely from the uterine cavity and the cervical canal. The length of the thread can be cut about 3 to 4 centimeters below the cervix. This will help for the patient to check the presence of the intrauterine device regularly by palpating the threads. Once the insertion is complete, the patient should be advised to regularly check for the presence of the threads by self-examination. This should be specially done immediately after a menstrual period. She should also be advised to seek medical advice if she cannot feel the threads or misses a menstrual period in spite of insertion of the intrauterine contraceptive device, since it is possible for this to fail in a small percentage of patients.